It's been really helpful in helping members just hear a very quick overview of what the different issues are that encompass public health. And more importantly, I think also providing members an opportunity with individuals who are in Massachusetts who can be a resource as we think through both policy challenges and I'd say at a time in which we're really going to have to work hard to think about what are the levers that we have available to us at the state level to protect public health, and how do we prioritize, knowing that it's all important. So really having that connection with faculty and staff at the School of Public Health. I would say as chair of the Committee on Public Health, I have found the BU School of Public Health to be invaluable and accessible over the last several years. And it's just really helpful to have my colleagues also have the opportunity to build those relationships. I think that one, we are trying to keep up with the overwhelming number of executive orders and cuts coming at the federal level and trying to understand where they will impact us in Massachusetts. And equally important, trying to understand, again, what levers we have as a state to both respond to those cuts and to the harm that will take place. So right now, we're continuing to assess. We've just started the committee process, so we have bills coming through the committee. And this is going to be an ongoing process between legislators, our constituents, leaders in the legislature, and to those like folks at the School of Public Health who can be important resources and partners in this work.
My job today was to talk about the power that states have over public health, and historically, states have quite a lot of power over public health. This is part of the reason, though, that we talk about zip code dictating health, because each state treats public health and healthcare differently. And so from a legal perspective, which is my perspective, this means that we have to think about how, when, and why states can act. Really, since the Great Depression, states have not been able to do a lot in the field of public health and medicine without federal partnership. And so we have to think about that partnership in its technical terms, which is federalism, which is the constitutional relationship between the federal government and the states. It means that the federal government and states have partnered in public health for a very long time, and the federal government has been a reliable partner in public health for a very long time. Sometimes the federal government acts with direct regulatory authority and sometimes with indirect regulatory authority. In public health, mostly it's indirect regulatory authority, meaning that the federal government is giving money to the states to act for public health or healthcare purposes. And so in this moment where the federal government is turning some of the funding off, that means that states still have the power that they've always had over public health, but they will have fewer resources. And that creates some quandaries because those resources have been a source of stability for decades upon decades. And so I encourage people who are working for state governments to understand that there are still things that states can do, but it's not so much about power as it is about resources. And so when we're thinking about how to use resources, there are some principles that can guide us in public health. In other words, we want to be thinking about how we reduce the risk of illness, injury, and death, how we can do that for all people across the state and not just in localities, because Massachusetts is a state that's so decentralized in its public health, this really matters. I would also encourage people to be thinking about the human right to health, because when we think about the right to health from a global perspective, from a human rights perspective, what that really tells us is that the project of seeking to improve public health is never finished, and that even when we are operating in a time where resources may be constrained, we still have the obligation to try to ensure that people can be as healthy as possible.
Communication is the engine for public health policy success, and it's not a mere afterthought. This is particularly important in today's infoscape, where misinformation can spread 6 times further and faster than the truth. What makes public health communication effective? First, stories, and then data. That way, we connect with individuals emotionally before we come through with the studies. Second is use plain language and visuals. Avoid using jargon whenever possible. The third is aligning with community values and priorities. In addition to health, there's also housing, jobs, the economy, transportation, and schools. These are all part of what make people's lives better and not just simply healthier. The fourth, partner with trusted messengers in the community so that there's more than one person, more than just academics and policymakers who are helping spread messages. And the fifth, consistency and transparency. These principles are key to making public health effective for all.
I talked about home rule, which is something in Massachusetts that's unique. So we have the state sanitary code, but municipalities in Massachusetts can make their own ordinances that are more protective than the sanitary code, which many do. It's our obligation to achieve the codes as well as whatever else we choose. So I talked to the Joint Commission about the sanitary code, about workforce training in Massachusetts, the findings of a special commission on public health in Massachusetts known as the Blueprint, which really basically said that we had a lot of issues with our public health infrastructure in Massachusetts, including in the area of workforce preparation, training, and credentialing. And in services that are provided across the state, there's a lot of inequities across cities and towns in terms of the funding and the capacity to make our cities and towns safe, to eat in restaurants, to swim in pools, to go to camp. So I talked about what we're doing at the School of Public Health to train local public health workforce in housing inspections and food safety, camps, wastewater, pools, working in partnership with the Office of Local and Regional Health at the State Department of Public Health and with our local public health community, the Mass Health Officers Association, the Mass Association of Health Boards, Mass Environmental Health Association, and the Mass Association of Public Health Nurses. But which is really important for our state to recognize is that over the last 20 years in training local public health, we've developed a lot of trust amongst ourselves, amongst local public health departments who had home rule and worked on their own, and now through state funding opportunities have shared resources and service agreements to really increase capacity and equity across cities and towns. That has been remarkable. It's a source of pride for local public health. And I want the Joint Committee on Public Health to recognize that these resources promoting shared services, promoting workforce training and capacity building are essential. And if they're not funded, I think a lot of trust in state public health will erode. As well as our public health institutions, including BU School of Public Health, that works hard to support local public health on the ground.
In partnership with Dr. McCloskey, today we talked to the Joint Committee about maternal health, and especially the landscape of maternal health in Massachusetts. We presented some statistics on maternal mortality, maternal morbidity, and we really pushed how Massachusetts is a pioneer and how they can continue to support pregnant and postpartum mothers here in the state.
Hi, I followed on Catherine's description of the landscape of maternal health in the country and in Massachusetts, where we learned that half of maternal deaths that happen are preventable. And a whole bunch of those, a third of those, happen in the postpartum period, where there's a lot we can do to improve the way we serve pregnant people. So I followed the talk with telling the members of the committee how important it was for them to follow the work they already achieved last year in passing a bill to promote midwifery and birth center care. And there's 4 bills right now that we were able to point out that make nurse midwives and professional midwives able to get loan forgiveness, funding for training, and to really make the interventions that have been recommended for years finally a reality, so that that's a sustainable occupation, certified nurse, bringing care much closer to the communities where deaths and severe morbidities are most likely to happen. And, by the way, to support community birth centers.
So I had discussed a number of different infectious diseases with the team from the legislature, but importantly, vaccine preventable diseases, in particular measles, which the U.S. is seeing more cases of measles in the first quarter of this year than we've seen in almost in decades. And part of the issue with measles is the sort of increased use of religious exemptions to not have children vaccinated for measles. And there's a discussion about the need to potentially try and eliminate that option. In addition, pertussis was covered because pertussis has been surging in recent years. And then Massachusetts is at risk for a number of vector-borne diseases, in particular mosquito and tick-borne diseases. Eastern equine encephalitis, scary one, not too common, but maybe happening more frequently. West Nile may occur again. And then, of course, the continued spread of Lyme disease and the need for surveillance and strategies to try and help people prevent becoming infected. Yeah, no, I think there's a lot of interest in the vaccines and the need for educating the public about sort of different vaccine preventable diseases and which ones are more lethal or more dangerous, so that they can prioritize those vaccines for their children, but also the need for greater education both by politicians, but also healthcare providers, so the general public has a better understanding of the importance of vaccines, but also which ones they should really focus on for their children and family members.
Today I had an opportunity to meet with representatives to discuss a paradox in the public health literature. We find continued declines in cardiovascular disease mortality in other wealthy nations, whereas the cardiovascular disease mortality rates have largely stagnated in the United States. So with representatives today, we talked about that puzzle and some of the ways that we might tackle these challenges in the state of Massachusetts. One of the issues that we grappled with talking with representatives today is, what are the role of these novel GLP-1 receptor agonists in public health treatment and prevention? We talked about how these are exciting drugs, but more evidence is needed on their efficacy and whether they're cost-saving. And we emphasize a continued need for preventative efforts focusing on nutrition, physical activity, and other root causes of the rising burden of cardiovascular disease in the population.
Should not be a surprise to anybody that Massachusetts is one of the most welcoming and legally prepared space for people of the trans community to be part of. Massachusetts is welcoming of all LGBTQ people and has been demonstrated since 2004, when it was the first state to recognize same-sex marriage. Nowadays, these policies have been challenged by the federal government, and we are seeing opportunities to do better, particularly for the care of trans people. For trans people, gender-affirming care is primary care, and gender-affirming care saves lives. It's been demonstrated that when trans people get the services that they need, we reduce the likelihood of mental disease, substance abuse, and we improve mental overall health. And the care of trans people is not only in the medical setting. It's important to secure housing that is safe and also affordable, that we remain having policies that protect from discrimination in the workplace and in education, and also that all our kids can enjoy sports and to get access to all the social services that are available.